Hello, I'm Urologist Erdem Akkaya. Today I will have a short video presentation on sleep apnea, snoring, erectile dysfunction. Sleep apnea is the cessation of breathing for more than 10 seconds during sleep. It is a disease characterized by disruption of deep sleep and a transition to superficial sleep during sleep, deterioration of sleep quality, waking up tired in the morning, daytime sleepiness, and loss of sex drive. We usually diagnose the disease with the help of the patient's partner because the patient's partner tells us that he stopped breathing during the night's sleep and woke up from his sleep by choking. These patients usually come to us with the complaint of snoring. Snoring alone should not be confused with sleep apnea. The mechanisms of the two are different. Sleep apnea is a disease characterized by stopping breathing while snoring is just noise. We see that the patient has stopped breathing and has diaphragmatic contractions. And he cannot breathe, and at the end of the video, we see that he is suffocated, and his deep sleep and sleep quality deteriorate. Here, we will see the mechanism by which sleep apnea occurs. Here we see the little tongue and tongue base. Look, there the root of the tongue is coming down and rubbing the little tongue. There is air passage here, with a snoring sound. But now the little tongue root also went down, and the respiratory tract is completely blocked, the little tongue also went down and the breathing stopped. This is the mechanism of sleep apnea. This is how the patient's respiratory mechanism stops. And the patient wakes up. Other chronic diseases often appear in sleep apnea patients. In addition, diseases such as hypertension, coronary diseases, obesity, and cholesterol can be observed in patients. The good thing about sleep apnea is that it has a very good treatment, with a positive pressure mask called CPAP. At night, the patient wears the mask, sleeps, and this mask prevents respiratory arrest. It eliminates the snoring of the patient. It increases the oxygen level of the patient in the blood. When the patient wakes up in the morning, he starts the day rested. During the day, sleepiness disappears, and sexual desire increases. In the studies, we see that the chronic diseases of the patient such as diabetes and blood pressure are improved with CPAP mechanism treatment. Most importantly, it was determined that there was a serious improvement in sexual desire and erectile dysfunction in patients with CPAP treatment. However, a rapid improvement in the testosterone rates of the patients was not detected. After the CPAP system is applied, the patient's metabolism will increase, so the patient's weight loss is accelerated. And after the patient loses weight, the testosterone level may increase, but no increase in testosterone levels was detected in the early period. However, a serious improvement in erection quality and erectile dysfunction was detected with CPAP treatment in patients with sleep apnea. Therefore, we always question situations such as snoring or sleep apnea in patients with complaints such as erectile dysfunction and premature ejaculation. And we ask for an opinion from ENT clinic to do this treatment. Because these patients benefit greatly from this. Thanks for listening.